Great. Stephanie, so what is the top legislative priority for your association?
So in a word, it's access. So we are primarily focusing on access in the regulatory and the policy environments. We're talking about access to primary and preventive care, behavioral health and dental care. We're looking at licensure, for instance, the interstate licensure compact that Eric just mentioned, because that could be a significant way to improve access. Also, a lot of behavioral health and substance abuse issues where we really need to get upstream and develop the access and maintain that access if we're going to start curbing downstream use of those services. So that would be number one. I would also put under the broad category of access, network adequacy. We're really trying to pay attention to that and are equally watching the state health employee issue because we saw firsthand what went into the giant transition around Medicaid and enrollment into the marketplace, and the total numbers are smaller than what we would be looking at with an employee change, state health employee change. And so the magnitude of disruption that's possible from that, both in creating insurance access and also healthcare access, is significant, and we want to be watching that very, very closely. And then secondly, we've already touched on the reimbursement issue that we're paying attention to, but we do want to make sure that we're keeping the legislature in the loop on our progress with that, because they did really take a significant investment in just monitoring that issue as of the beginning of the process.
Great, thank you.